So you want to get your implants out, but you don't know where to start. Don't worry, I've been there and I'm going to tell you everything I know about choosing the right explant surgeon. Hi everyone, my name is Monica. Welcome back to my channel. I do a lot of lifestyle and explant related content. One of the most common questions I get on my explant surgery is how did you pick your surgeon? So today I'm going to tell you guys everything that I would personally take into consideration to choose a surgeon. So if you want to learn more or just hang out with me, make sure you subscribe and let's just get into it. Okay, I have a list here on my phone. I'm gonna start off with the must-haves and then we're gonna move on to the nice-to-haves. And then I'm gonna talk about some red flags that you should definitely look out for.
This is all in my opinion, in my experience, and what I would do if I was picking an explant surgeon today.
As always, do your own research, go with your gut, do what makes you comfortable. The first thing I wanna mention is that you should always go to more than one consultation. You could go to one consultation and be like, oh my God, that was great, yes, and then go to another one and be like, oh wow, that one doesn't seem that great now. Each surgeon does things a little bit differently, so going to multiple consultations is going to help you figure out which doctor is going to be the best for you. Okay, so the first must-have for me is that the surgeon would need to, by default, do an EN-BLOC capsulectomy. So an EN-BLOC capsulectomy is a method of removal where they attempt to remove the capsule, which is the scar tissue around the implant, and the actual implant together in one piece at the same time. And the point of that is to make sure that nothing within the capsule or the implant, especially if it's ruptured, seeps into the body during removal. It can't always be done, especially in my case. My capsules were very thin and not completely covering the implant, so it's technically not an EN-BLOC, but at least it was attempted. Another must-have is that the surgeon removes all of the capsule and all of the remaining scar tissue that is left behind. I don't want any remnants of scar tissue in there. I don't want any of the capsule left in there. Just take it all out. I don't want anything left behind in there. Another must-have is having gotten recommendations for that surgeon and having seen reviews and results from actual patients. So in my case, I went into one of the breast implant illness Facebook groups that I'm a part of, and I made a post and I just asked for recommendations in my area, and there was an overwhelming amount of recommendations for the surgeon I went to, so that was a good sign. Some of my surgeon's actual patients offered to send me before and after photos of themselves, so that was extremely helpful, and he had very good reviews online, so that all checked out. Another must-have is that they are a board certified plastic surgeon. So that means they are certified by the American Board of Plastic Surgery. I won't get into the specifics of what that all means, but you want to make sure that your surgeon is credible, that he has done all of the necessary requirements, testing, continuing education, a certain amount of years with surgical training. All of that. My surgeon was double board certified, so he checked out there. Another must-have is that the surgeon is experienced with doing a certain amount of explants a year. Removing the implants is a lot different than just putting them in, so we want to make sure that whoever we're choosing knows what they're doing. I did not want a surgeon who just did explants here and there. I made sure to ask my surgeon how many explants he does per year. They told me my surgeon does hundreds of explants a year, so that was a green flag. Another must-have is that the surgeon needs to have good bedside manner. I know that you probably hear this a lot, but it really is important that you feel comfortable with your surgeon. Choose a surgeon who spends time answering all your questions. There's a lot to go over when you're thinking about removing your breast implants. You can tell how much a doctor really cares about their patients by their bedside manner. So make sure that whoever you choose takes their time with you, is friendly, answers all of your questions, makes you feel comfortable, and reassures you about anything that you're worried about. Another must-have for me is that the doctor sends the capsules to pathology. Not every surgeon does this, but in my opinion, they should. For me, this was not negotiable. I want to make sure that the capsule doesn't contain any abnormalities, any abnormal cells, or anything that looks concerning, especially if there's a rupture. Another must-have for me was that the doctor take pictures of the implants and the capsules after removing them. This is mostly for peace of mind. I want to see that the implants were in one piece, that they weren't ruptured, that they're actually taken out, what they looked like. That was really important for me, just to see them. This is more for proof and peace of mind that the EN-BLOC was attempted. In my pictures, you can see the implants and the capsules around them although they're not fully formed around the implant, you know, it's still that peace of mind and that proof that they took them out and they attempted it. Because I've seen women who down the line don't really know if their implants were in one piece, if they were ruptured, if they really attempted an EN-BLOC. So the pictures kind of serve as proof. The last must-have for me is that the surgeon should in some way acknowledge that implants are causing women issues and somehow their symptoms are alleviated after removing the implants. I don't necessarily need them to sit there and go hard on breast implant illness. We know it's real, we know the truth, but I did need them in some way to acknowledge the symptoms. Okay, moving on to the nice to haves. So the first one is a surgeon who believes in and advocates for breast implant illness. So a lot of women feel they can only go to a surgeon that believes in breast implant illness and that advocates for it, and rightfully so. An extremely nice to have would be someone who no longer does breast implant surgeries. So by choosing to no longer perform breast augmentations really shows where you stand on breast implant illness, but also morally, how can you continue to perform a surgery that you know so many women are complaining about their health because of, or that you know is not safe. I wouldn't say it's super easy to find a surgeon who no longer does implants, but it is possible. And the last really nice to have is additional training in reconstructive surgery. So like I said, removing the implants is a lot different from just putting them in. And in some cases like my own, you do need muscle repair. So basically if you have implants under the muscle, the implant kind of moves forward, and when they take out the implant, they kind of have to pin it back down. And not all surgeons will do the muscle repair automatically while they're in there. It's something that you have to discuss beforehand. The surgeon I went to let me know that he does do it if he's in there and he feels the need for it, but not all surgeons will automatically do it. Just be careful, because I have heard of women who later down the line after their explant have to go back and get muscle repair done because either their muscle hurts or their muscle is out of place. So just make sure you ask about it. Okay, lastly, I'm gonna go over some major red flags. I learned these all firsthand going back to my original surgeon for my first consultation. So the first red flag is the price being very cheap. So don't go with someone just because the price is very cheap. If it's not around the average price of other surgeons in your area, in my opinion, it's not gonna get done right. When I looked at the breakdown for a very low priced explant, I realized that it was because they were not going to be doing the surgery the way that I believe it should be done. They wouldn't have removed all of the capsule, they wouldn't have attempted EN-BLOC, and that just wasn't okay for me. The next red flag is a surgeon who tries to make you feel dumb or stupid for voicing your concerns about breast implant illness. If they say breast implant illness was made up by a group of women online who wanted to go after the plastic surgery industry, run. If they downplay your symptoms, make them seem like they're all in your head or it's just anxiety or your hormones, run. The next red flag is a surgeon who tries to convince you to keep them. If they try to convince you that they look so good and you should keep them or go smaller, run. That is not a good sign, especially if you've just voiced your concerns about health issues or not wanting to have the foreign object in your body anymore. It's just not a good look. Another red flag is someone who says that they leave the capsule in and that it'll dissolve later and you don't need to take all the capsule out. Remove everything so that you can just put it behind you and move on with your life. If you're going to do the explant surgery, do it right. You're spending time, money, energy on this. You don't want to be years down the line having to go back in for surgery because your capsules weren't removed. My last red flag is a surgeon who rushes through your consultation. If they're rushing you to get on to the next patient or they seem annoyed that you're asking a lot of questions, you want to choose somebody who takes their time with you. Make sure that they answer all of your questions and that you don't leave the room more confused than you came in. You're going to have a lot of questions, as you should, and if the doctor doesn't want to take the time to answer all of those questions for you, then they don't deserve for you to trust them with your surgery. Getting your implants removed can be a very delicate and personal conversation, and it should not be rushed. All right, that is all I have for you on how to pick your explant surgeon. If you have any other questions, feel free to leave them down below or head over to my other social media platforms. I answer a lot of questions there. Thank you guys so much for watching. Make sure to subscribe to my channel, give this video a thumbs up if you found it helpful, and I will see you guys in my next video.